topic. Today's topic is about therapy, specifically therapy in oncology care. So, um, I think therapy in oncology doesn't get as much attention as chemotherapy, radiation, or surgery. When people hear the word therapy, they often think, "Hmm, something must be wrong with me, or I should be able to handle things on my own. Other people have it worse. I don't need it. I don't deserve to complain." But today I want to shift that perspective where therapy isn't about fixing something that's broken, but instead it's about helping people adapt to one of the biggest life transitions they may ever experience. Cancer doesn't only affect the body, it affects your thoughts, your relationship, your identity, your future plans, your confidence, your sense of safety, and every one of those deserves care. So let's start with a simple question. What is therapy? You can put in the chat what you think therapy is, what therapy is in a broad sense of the term, or even specifically psychotherapy or talk therapy. So let me know what you think in the chat. And I'll say therapy is a broad term that includes treatments that help heal the mind or the body. Today, we're specifically talking about psychotherapy or talk therapy, which is working with a licensed mental health professional to help you understand your thoughts, emotions, behaviors, and develop healthy ways to cope. Think of it this way. If physical therapy helps rebuild muscles after surgery, psychotherapy helps rebuild emotional strength after life changes. It gives you a place where you don't have to protect anyone else, a place where you can be scared, you could be angry, you could be hopeful, confused, or all of those things at the same time. Therapy with a licensed professional, the benefit of that is that you are speaking with someone who is not biased, they're completely objective, and you don't have to protect their emotions because you know this is what they do. Whereas with family, it can be therapeutic to talk to family or friends about your feelings. But often, when someone's so close to you, especially when talking about cancer, there's a lot of fear. And sometimes that gets in the way of being completely honest and truthful about how you feel. Maybe you don't want to hurt that other person, or maybe you don't want them to worry so much. So that's a great benefit for having therapy with a professional. So why would someone need therapy after a cancer diagnosis? Well, because a cancer diagnosis changes life overnight. One appointment can suddenly shift everything. You may be asking yourself, what does this mean? Will treatment work? Who will take care of me? Who will take care of my family? What happens if I can't work? Will I ever feel like myself again? These aren't just medical questions, these are emotional questions. Cancer disrupts every part of life. It can change your body, your health, your identity, your relationships, your career, your sense of purpose, your future plans, just to name a few. Sometimes cancer can also magnify struggles that already existed. Maybe anxiety was manageable before, maybe depression was under control, maybe relationships problems were already there. Cancer has a way of shining a spotlight on everything. It doesn't mean you're weak, it means you're human. So let's clear up a few common myths about therapy. So, myth number one, I must be crazy if I need therapy. Not at all. Depression and anxiety are common survival responses to overwhelming stress. It's not a character flaw, it's not a choice. Cancer places the body under tremendous physical and emotional strain. Treatment itself can also affect brain chemistry. Changes in neurotransmitters like serotonin, dopamine, and norepinephrine can influence your mood, energy, sleep, concentration, motivation. I mean, imagine whether it's chemotherapy, dealing with the effects of the side effects, radiation side effects, or even watching and waiting and just knowing that there's cancer there and just waiting to see what's going to happen next. These are all very stressful factors that can really impact your brain down to a cellular level. Feeling anxious and depressed does not mean you're failing. It often means your brain and body are responding to an extraordinary situation. Myth number two, I should be strong. Strength isn't pretending that you're okay. Strength is asking for support when you need it. Sometimes strength, the strongest and courageous thing you can do is to be vulnerable and to allow yourself to feel and allow those emotions to flow and process instead of holding on to them and keeping them inside where they just build up when your body's already doing enough in treatment or in healing or even just adjusting to life with this diagnosis. And myth number three, therapy won't change my cancer. That's true. Therapy does not cure cancer, but it can help reduce suffering while you're living through it. It can help improve quality of life. It can help you identify your goals. It can help you identify where the cancer is magnifying certain situations in your life. It can help you to just have this place to allow yourself to feel and sift through your emotions. So, next, I'm going to talk about the emotional stages of cancer. One of the most important things to understand is that emotional needs change throughout the cancer journey. Therapy looks different depending on where someone is. So the first stage is diagnosis stage. The diagnosis stage is often overwhelming. Sometimes people in the stage could be in autopilot mode where it's like the only way to deal with it is feeling numb. Other people feel completely terrified. Everything starts happening so quickly. Appointments, scans, treatment decisions. medical terminology, insurance, second opinions, family conversations. It can feel impossible to keep up. It can feel like you're drowning. Therapy helps by normalizing distress, so you know that you're not crazy, reminding you that you're human and that as a human, you can only take so much until it becomes overwhelming. It can help reduce confusion so that you can have a clearer picture of how to navigate and take the next steps. It can help organize information, especially going into those appointments. Maybe you wait months, weeks to talk to an oncologist, to talk to a specialist. When you finally enter that room, the overwhelming sense of stress and fear that puts you in that stress response and kind of shuts off that rational thinking where you had all these questions that you wanted to ask, all these things that you didn't understand that you wanted to know. That whole part of your brain shuts off in that moment, and that emotional part, that fear gets heightened. It's really hard to concentrate, which is why a lot of people say to, like, have a journal, write everything down um, for that purpose, or even having a family member there. But point is, in therapy, it can help to kind of come up with techniques to reduce confusion, and even find a advocacy. Helps to identify social support systems, discuss advanced directives and goals of care, and also just having a place to just kind of let go. And again, maybe I'll refer to this several times, but letting those emotions just kind of flow out like water instead of holding them all in. The goal isn't to have all the answers. The goal is helping patients feel like they understand what's happening, they know what their options are or how to find the options, to know that they have support and that they have control to make informed decisions. The second stage is treatment stage. Treatment often changes how people see themselves. They may deal with hair loss, the changes in their appearance, weight changes, scars, fatigue, and not just physical fatigue, but also that mental fatigue, that deep fatigue where even thinking sometimes it's just too much. Pain, neuropathy, changes in sexuality, changes in libido, changes in independence. Many people grieve the body they used to have. Many people's relationship with their body changes in a negative way. Therapy gives permission to grieve those losses. A clinician could say something like, your body has been through a lot. It's okay to grieve how things were, while also honoring everything your body has done to get you here and everything your body is doing to keep you going. In this stage, therapy sessions might include developing mindfulness skills. Mindfulness meaning just the act of being in the present moment, noticing it without changing it, altering it, just existing in it. Another skill is guided imagery, which can really, it also goes hand in hand with mindfulness, where you can really make a conscious effort to guide your thoughts into certain imagery. Relaxation exercises, journaling, cognitive restructuring. So it's kind of a clinical, fancy clinical way of saying like noticing thought patterns and changing them. And then body image work as well. The goal here in this stage is to help patients maintain resilience and self-worth while navigating physical changes. The next stage is evaluation stage or Scanxiety. Many people know this feeling. The days before a scan, that sense of fear that starts to take over, or after waiting for the results, or every ache suddenly feels significant. Every phone call suddenly feels frightening. This is known as Scanxiety, and it's very common. And therapy can help in this stage by um, helping you build those grounding techniques where you can um, you can manage your nervous system. Imagine, having an appointment where you're going to have a scan come up, and maybe 2 days before you just feel that anxiousness, that fear, and your nervous system is overactive. And grounding techniques help you to soothe it and to calm down so that you can sleep, so that you can function, hopefully, so that that anxiety isn't controlling you, it's not running you. So in therapy, in this stage, it's important to learn grounding techniques, um, breathing exercises, which really help to regulate the nervous system, that vagus nerve. Um, Learn breathing techniques are so you always have your breath. You never have to pay for it. You carry it wherever you go. It's so empowering just to use something within you to help you regulate yourself, to help you feel like you have control over the situation just by breathing. So, breathing exercises is something that you would hopefully develop or learn to be open to learning in this stage. Again, practicing that mindfulness, learning how to notice thoughts and redirecting your thoughts to focusing on what's happening in the moment versus, maybe noticing an automatic negative thought and following it, which may kind of pull you into a negative spiral, which impacts your emotion, might put you in a fearful or depressive state. And these are all ways to interrupt that catastrophic thinking. Therapists often encourage patients to create self-care rituals around scans. So things that you want to do before to kind of prepare yourself and take care of yourself for a period that might be difficult. And then even afterwards, what things can you do to help, again, regulate your nervous system and feel safe overall? Maybe it's going for coffee afterward. Maybe it's taking the day off. Maybe it's taking a walk or planning something comforting, regardless of the outcome. The goal here is to help patients or clients feel emotionally safe during periods of uncertainty. The next stage is grief and loss stage. Grief in cancer is not only about death. People grieve their health, their energy level, their cognitive functioning, their independence, their fertility, career goals, relationships, future plans, their old identity. Therapy validates every one of those losses. In this stage, patients may explore legacy projects, writing letters, um, creating videos or recordings, life reviews, creative expressions like art therapy, music therapy, movement therapy, and also finding new meaning. The goal becomes about redefining identity rather than just returning to who you were before the cancer. I often say, once a person receives the diagnosis of cancer, they can never be the person they were before. There's no going back. And the last stage is survivorship. Many people expect life to simply go back to normal once treatment ends, especially family members and friends. But survivors often say that that's when everything finally hit them. The appointments become less frequent, the support from friends or family start to decrease. People assume you're okay, especially for those who don't look sick. And the sad part is, survivors need just as much or even some more support. And oftentimes, family members, friends don't understand that. Again, once once a person gets that diagnosis, it changes them for life. It's a lot of people describe it as like having this dark cloud that's like up there somewhere. It's always following them. Sometimes it could be right over their head, raining. Other times it's in the distance, but it's always there. And learning how to adjust and manage with that is a journey. And emotionally, many survivors continue to struggle. They struggle from the fear of recurrence, fatigue, anxiety, body changes, difficulty returning to work, changes in relationships. Therapy reminds us you survived cancer, but healing didn't stop the day treatment ended. One thing I tell many survivors is, many people think that, you should feel relieved after treatment, but it's actually very common for the emotional impact to become stronger once survival mode ends. Again, kind of being that autopilot, um, survival response mode to kind of help you just survive getting through it. And then once your nervous system is like, okay, we can move out of that survival mode where we're just kind of going through the motions to move forward, then it's like it hits you like, wow, look at what just happened to me. Like, where did the time go? Or so many changes. I had no control over it. And it can bring anger. People can be angry, and that's normal, and that's also a part of the grieving process. Therapy helps to validate those experiences and provides long-term emotional support while helping patients rebuild their daily life. So, final thoughts. If there's one thing I hope you remember today, it's this. Seeking therapy does not mean you're not coping. It means you're giving yourself another tool. Just as your oncologist helps care for your body, your therapist helps care for your emotional well-being. Cancer changes life. You don't have to navigate those things alone. Healing isn't only about eliminating disease. Healing is also learning how to live, adapt, grieve, hope, and find meaning through one of life's greatest challenges. If you have any questions or would like to learn more about counseling services, or you know somebody who needs it, please refer them, send us our way, and we'd be happy to talk to them. So thank you. And just let me know if you have any questions or maybe what your experience with therapy is like. All right. Well, again, thank you for being here. Oh, we have a question. So, Dr. Wendy asked, do you think every cancer patient should have therapy? Do I think that? Yes, I think every patient should have therapy. I think everybody should have therapy. Okay, Marvina says she's having a good experience with her therapy. That's great. Happy to hear that. Another thing is, again, therapy, the psychotherapy where you're talking to a licensed clinical counselor or therapist, social worker. But therapy can also mean doing other things that give you that sense of safety. Therapy can be exercising, it can be listening to music, it can be drawing, it could be writing, it could be knitting, any of those things that help you to kind of, again, regulate your nervous system, feel calm enough so that you can process emotions. You're not in that fight, flight state, stress response. You're in that rest, healing, rebuilding state, which helps to like bring clarity into what you're thinking. So Dr. Wendy asks, what are your thoughts on survivorship in therapy? Should primary care providers be trained to discuss therapy with cancer survivors? Yes, definitely. I think therapy is really important in survivorship because again, once you get the diagnosis, and you just kind of get on the train of I have the diagnosis. Now I got to schedule these um, appointments, maybe surgery, first treatment, boom, side effects. Everything happens so fast. And again, that that autopilot mode to just survive and get through everything. Our psyche has this incredible way of protecting us when we are going through really stressful, even traumatic experiences, um, by like shutting off certain aspects of like understanding a situation so that we can get through it. And I think once once a person is done with treatment and they now have, not only are they not as busy, because it's almost as if that treatment becomes their purpose. Like you have this huge shift in your life where, you were this person, you were going to work, you had this routine to boom, got this diagnosis, you're having all this treatment, maybe lots of different side effects, can't work. You have to completely shift, who you think you are, and then it comes to an abrupt end. And you're left with like these pieces that you're trying to rebuild. And it's a lot for one person to do on their own, and they definitely shouldn't have to. Um, there's no time really to really grieve what was lost. There's no time to really think about like what's happening. It's all about making decision after decision. So anyway, yes, I could go on and on. I think primary care providers need to be trained to discuss therapy with cancer survivors. So great questions, great comments. Thank you, everybody, and have a wonderful day. See you next week.